Okay. All right. Well, hello, everyone, and welcome to this afternoon's webinar. And I want to thank the staff at IRETA for inviting me to do this. For this webinar, today we're going to talk about the tips for enhancing brief interventions, and that is nutrition, diet, and sleep. And that's during the substance addiction and recovery phases. And what I wanted to do is I felt it was important to narrow down the nutrition and diet portion of my talk to specifically focus on sugar addiction. And for our learning objectives, we're going to take a brief look at why clients can sometimes transfer from a substance addiction to a sugar addiction. And tips will be shared on how to help with decreasing the chances of sugar addiction. An exploration of how substance addiction can cause sleep problems, and I'll provide some examples for effective methods to reduce the frustration associated with those sleep problems. All right. Now, this next slide here, but before I go into the next slide, just a side note, the information in this webinar is for educational purposes, and it should not be taken as professional medical advice. And now on to this quote. I wanted to start off by just pointing out this quote that I found about addiction. And I heard, and maybe some of you may have heard this as well. And just to kind of digest this a little bit, addiction is the solution to unresolved problems. And I wanted to point this out because generally people don't realize the full reasons why they become addicted to something. People just happen to try something, and then they find out that it can temporarily numb their negative feelings and anxieties towards their overwhelming situations. Then this, as you all are aware of, I'm sure, becomes a habit and a quick fix that spirals out of control. So just to throw this out there, just to kind of get an idea, I have a poll question for everyone. And I believe Chris will prepare that for you. And this is, do you believe that people can really become addicted to sugar? And your choices are yes, definitely, no, that's crazy, or only if they eat really sweet things, or yes, but it's not that serious. So you can just go ahead and make your choices, your choice.
Okay, Monica, it looks like not all the options were listed, so I'll give you the results from the two that are entered.
Oh, okay. Or I can, would you like me to verbalize all of the options?
But that's okay.
Okay.
I have yes, definitely, that they can get addicted, and that's 96%. So you've got pretty overwhelming numbers there. And then 4% are no, that's crazy. So,
okay.
So I think it's pretty firm.
Oh, yes. And that's really good. So those of you who answered yes, definitely, you are correct. The average American now consumes more than 100 pounds of sugar per year. And only 8%, or I'm sorry, everyone else, I should say, on average, consumes about 8 pounds of broccoli, for example, in comparison. So yes, definitely is the answer, because more people we consume, and they specify just Americans, a lot more sugar products than they do vegetable products. And when I first learned about this was a wow moment for me. And the U.S. Department of Agriculture recommends that we get no more than 10 teaspoons of sugar per day, yet most Americans eat about 30 teaspoons per day. So as you can see, that's 3 times the recommended daily value. And, you know, a lot of people don't find that a problem. So just as a side note, when sugar is unprocessed, it contains a variety of vitamins, minerals, enzymes, and proteins. But when sugar is made into a processed, refined table sugar, then it becomes very different. It then lacks vitamins, minerals, and fiber. And it requires extra effort for our bodies to digest, which means this can lead to many problems down the line. So, my next point here is something to really consider. Most people categorize an addiction, of course, with someone who's just addicted to alcohol, street drugs, or over-the-counter drugs. But slowly, people are getting more and more educated on the not-so-obvious addictions. And, for example, not-so-obvious ones are what we're talking about now. Currently is sugar addiction. Addiction to negative thinking and depression is also a not-so-obvious addiction, as well as emotional eating. So, yes, these types of addictions can become out of control and very toxic as well. So to have an addiction problem to the not-so-obvious things, they are just as harmful to our bodies and our well-being as alcohol and drugs are. So from my research, as well as what most of you already know, one addiction can be replaced with another. So the last thing I'm sure you would want for your clients is for them to recover from a substance and then become addicted to sugar or food in general. So most people feel that sugar addiction is okay and it can be easily fixed. But the truth is no, it can be just as hard to recover from a sugar addiction as it is from a substance abuse one. And it's often the root cause, this is real important, it's often the root cause of relapse for alcoholics and drug addicts who are in recovery. So, but normally when people who enjoy sugar on occasion as a harmless indulgence, they can easily give it up for weeks or even months at a time without feeling cravings for it. But most of us who consume sugar on a regular basis do so because our minds become focused on it and we feel our bodies go into a slump or withdrawal without it. So sugar addiction, as you're seeing, it can be just as persistent as any other harmful substance, and the compulsion to eat it is just as strong in spite of the desire to stop that use. So most of us who eat sugar on a regular basis and crave it many times throughout the day know that these strong compulsions to eat sweets are very different. And they're very different from just a regular hunger or even just wanting like a small treat. So that's something to kind of think about and start to digest as we're talking. Now, my next slide here demonstrates that sugar, and as I'll continue to explain, gives dopamine a high five. And I titled it that because when drugs are gone from a recovering addict, there can be a high chance that they will look for other ways to increase their dopamine level. And as most of you, if not all of you know, the dopamine is the chemical that controls pleasure in the brain. And sugar triggers dopamine just as quickly as the user's prior substance. So sugar enters into the bloodstream fast, and it wreaks havoc on our blood sugar level. It first pushes it sky high, causing excitability sometimes, nervous tension, and hyperactivity. And you can see this in children and teens as well. And then what happens is it drops extremely low and causing fatigue, depression, weariness, and exhaustion. In children, they may get whiny and fussy. Teens get irritable and really emotional. Actually, teens can get whiny and fussy too. So these are just like little things to kind of, actually they're not little, these are symptoms, I should say, of beginnings of what can occur when a person constantly puts sugar in their system. Now, I'm going to actually talk about the brain and cocaine and the similarity of sugar. So when this very high spike is then followed by a very low drop, the person tends to get hungry again. So the low blood sugar not only causes fatigue and depression, but it also leaves them feeling shaky and searching for more sweets to regain that sugar high. So I'm sure most of you are seeing the similarities, those of you who actually deal with people who are addicted to substance on a normal basis, you can kind of see the similarity. So as you know, addiction happens when that cycle spirals out of control. Sugar gives a subtle intoxicating effect that people describe as an escape or soothing effect. And it may seem that developing a sugar addiction is relatively safe compared to alcoholism, for instance, but eating too much sugar can trigger serious unhealthy consequences for a recovering addict. And that's because it creates a beta endorphin rush, much like morphine and cocaine, as you can see here. And that, therefore, puts a person in a vicious cycle and can cause other problems like weight gain, sleep problems, and other illnesses. Now we can actually look into what illnesses are caused by overindulgence with sugar. And some people are a little surprised by this. Others know that this is definitely a fact. Some of these illnesses are diabetes, heart disease, high blood pressure, obesity, headaches, including migraines. And let me just briefly talk about migraines. Most people think that they get this because of stress. Well, that is true. But for the most part, if they are often eating whole packs of cookies, or for instance, or a donut with their coffee every morning, then that could be the biggest culprit for the migraine. Also, findings are showing that prostate cancer and ovarian cancer is also a result illness from overindulgence of sugar. Now, these illnesses can become worse if the person continues to feed their body too much sugar. If the individual believes that sugar is not one of the causes or even the cause, or they don't even recognize that their sugar cravings are out of control, then the possibility of a sugar addiction can be overlooked or not even considered. And their illnesses are just treated with medications as the only solution, and the person ends up taking those medications for years or the rest of their lives. And then, of course, the person unknowingly continues to eat sugar, and that will continue to feed the problem. So just a note, outside of addiction, another reason for these illnesses can be because a person may have sugar sensitivities or even allergies to sugar. So that's something to look into and to consider for your clients as well. And if this person keeps eating too much of it, and then these illnesses become a red flag that something toxic, i.e. sugar, continues to be put in the individual's body. Now, clients can or just anyone actually who could be suspected to be addicted to sugar, a doctor can run an allergy test to determine if the person does have a true allergy. However, allergy testing will not determine if you have a sensitivity, but there are tests that can be used to identify hidden food sensitivities like sugar, for instance. So when you have a sugar sensitivity, most often people are found to have other food sensitivities as well that go hand in hand. So that's something to also kind of talk to your clients about if, in fact, they're experiencing something in this category. But it's most important to remember that with all medical conditions, the client is to continue to consult a qualified medical professional, even if it's discovered that sugar is the culprit or the main problem to their illnesses. So measures to help the client detox from sugar should be taken along with their medical attention. Now, I actually have a question. It's not a poll question, but you can answer in the chat area, I believe, or verbally. And if you know, what are some of the signs of sugar addiction? And I'm not sure if any answers are going in the chat box.
Not yet. Sometimes it takes a while. Oh, here we go. We've got cravings, headaches, shakiness. Yeah, craving sugary foods.
Okay. Definitely.
Irritability, crashes. So I'll leave it at those for you.
Definitely. So some of you are realizing that sugar addiction, or those of you who definitely deal with substance abuse addicts, you're seeing or already knowing some of the signs because they're pretty much equivalent to when a person has sugar addiction as well. Some of them are overwhelming desires for sweet things and they can't fight it. Feeling sluggish or fatigued after eating sugar, but the person continues to eat it anyway, just equivalent to the substance abuse. It's wreaking havoc on their systems or they're feeling very negative results from it, but yet they keep using. So it's the same concept. The need for sugary foods to experience a pick-me-up or to reduce negative emotions. That's that concept of the person indulging when they're depressed. They're indulging in like a whole container of ice cream, for instance. Or if a person would rather eat dessert instead of their meal, or they eat dessert after every meal. And they may not even notice that they do that. So there are more signs of sugar addiction, but the main one to recognize is if a client's cravings become out of control, or if they become obsessive or excessive. And once an individual realizes or they're told that processed sugar is an empty-calorie food and it's a chemical that proves to affect them in a negative way, if they're properly informed and educated, but they continue to overly consume it anyway, as I was kind of stating earlier, then there is a high possibility that that individual, as I explained, will have long-term consequences, and they're definitely showing signs of sugar addiction. Now, I wanted to kind of just illustrate an example of a vicious cycle. Again, it's along the lines of what a substance abuse, a person that's addicted to substance abuse goes through. I wanted to illustrate the vicious cycle just to give you a mental visual picture. When a person misses whatever substance that they use to block out or feel better about their emotional stress or emotional triggers, what they'll do is, like we explained earlier, is find something to keep that dopamine level high. And they utilize sweets to give them the relief that they felt when they were using the substance. And over time, the individual may become even more depressed because they start gaining weight, for instance, from the sugar intake. Or, as I explained, they're starting to get ill from it. So there's a high possibility of depression, which then causes the individual to feel that yet there's another thing in life that they can't control. So they continue to turn to the sweets to not only fulfill their cravings, but to fill a void or to temporarily relieve their depression. So it's important to teach the client that the food that they put in their bodies is something that they can control. And with the acknowledgement of the signs and the proper assistance, getting through this type of addiction is just as possible as it is to get through their prior substance one. So it's important to realize that a person can get through this. So helping the client make better choices in food when they show one or more of these signs that I mentioned earlier, that will definitely have a positive impact on their health, their emotional stability, and even their physical appearance. Because when a person overindulges in sugar, not only just weight gain they experience, some people experience different skin problems. They, of course, have the emotional and psychological problems as well, but a person, their whole appearance is sluggish. Some people, like I said, if they have some sort of sensitivity, they get the rashes or their joints may hurt. So different things like that can occur. Now, there are many other names for this syndrome, and it affects people that have an ongoing craving for processed sugar and starches. So I put here sugar addiction, a not-so-sweet name. The first one is sugar sugar toxicity syndrome, sugar sensitivity, I'm getting tongue-tied here, and sugar allergy, and carbohydrate intolerance. Now, the name used to label the syndrome is of little importance, but educating clients about the possibility of this type of addiction happening when they're in recovery, now that's important. And recognizing the symptoms when they begin or controlling the craving cycle before it becomes a problem is definitely a recommended additional focus for clients who are in treatment. Now, you won't always see the word sugar on a food label. Now, that's something that's important to start to realize, too. It can be hiding inside of a package under a different name, and often when people don't see the word sugar, they feel that the product is fine, and very few people look at the different names of sugar. So if you look at the nutritional facts also and see how many grams of sugar are in a product, that will be a big red flag as well. So it's valuable to teach clients other names to look for with sugar. And I have a slide here that shows that there are many different names for sugar, and I just listed a few here. And that's, of course, lactose or milk sugar, brown sugar, high fructose corn syrup. Now, that one is really not good. And if you start to pay attention to ingredients and labels on our food, it's in a ton of our food, even when you least expect it to be there, which I'll talk about soon. Evaporated cane juice, molasses, sucrose or table sugar. These are different, forms, as I explained, names for sugar. And packages that list any form of sugar in the first few ingredients, or if they contain more than 4 total grams of sugar, then they're not worth eating on a regular basis. Now, as I was explaining, high fructose corn syrup, for instance, is a big culprit. It's in places that you won't expect it, like bread. And sugar in general can hide where you least expect it. And where it doesn't seem like it would be, for instance, like in condiments, like ketchup, barbecue sauce, pasta sauce. These items can have a ton of sugar, as well as salad dressings, white bread, and flavored coffees, some of them. So it's best to teach clients who seem to be showing signs of uncontrolled cravings to get in the habit of reading labels, and that's in order to filter out the not so obvious high sugar foods, and that's before they even start to buy them. And it's good to actually learn. You can do research, further research on this yourself. Actually get in touch with a nutritionist as well, and they can actually educate someone further on how many grams of sugar should be in a certain item. Now, some common addictions are with these foods that I've listed here. We all know chocolate, that's a favorite. There's pastries. Again, white bread, so there's breads that come with our meals when we go out to eat. And soda. As you can see here, I have an illustration of soda equivalent to 16 teaspoons of sugar, and that is a lot. It's a very popular craving choice, and it's known as liquid crack or liquid candy. And the National Center for Health Statistics found that half of the U.S. population older than 2 years old consumes sugary drinks daily. And an approved level of sugar for an average person who does not have an addiction is no more than 6 teaspoons daily for women, and men should get a maximum of 9 teaspoons. That's it. However, as I stated earlier, we, as a whole in America, go over that. And some people go over that several times a day. So when someone has been addicted to a substance, the substance and the behaviors that went with it has been their habit for many years. So that's something to also process as well. So the challenge will be to help them to substitute sugar cravings with healthier alternatives, as well as helping them to create new behavioral habits. And I kind of want to go into some new habits that you can teach your clients to acquire. And that is to eat breakfast. A lot of us skip breakfast. If you do it every now and then, it's okay. But there's a lot of us who are busy and we skip breakfast all the time, and all that will do is cause more desires for cravings, cause us to just grab, unnutritious things throughout the day. So it's important to try and eat protein with every meal or even your snack. Cooking more at home. Now, that's very important. And because what that does is just help control factors, is to how much sugar is going into a food. Also, too, cutting down on fast foods. That is huge. And the reason being is because, as most of you know, fast foods are full of preservatives and they're also full of sugar. And another habit is to get rid of the artificial sweeteners and things with high fructose corn syrup. Here we go with that again. Because that is everywhere. It's in everything. And it's a chemical that really should not be in our system. Drink extra water. Now, that actually is pretty important as well, to drink extra water, because what happens is a person kind of goes into dehydration if they don't drink enough water. And going into that transition makes a person crave more as well. Crave more sweets, just crave more processed foods. So that is just something to kind of focus on as well. Exercise 30 minutes per day, 3 to 5 days a week, outside preferably. That's something to help a person incorporate as well. And if you can help the client incorporate meditation and prayer daily, it just helps them get focused in a different arena, just starting to pay attention to do other things to relieve that stress and that pressure that they feel, or that's causing them to turn to the sweets to relieve that stress. So you're just getting them refocused in another direction. Now, food should be enjoyed and not a problem. Small changes, such as cooking more at home, eating more organic, they can be first steps. And if a client becomes addicted, they should be advised to eliminate sugar altogether from their home and other places where they consume it. Like, for instance, maybe ask and talk with the person. Do they leave like little snacks, little sugary snacks in their desk drawer at their office? Do they have candy dishes sitting around their home or even on their office desk? A lot of us do that, and what that will do is just the person's not paying attention. They'll just snack out of that candy dish all day long. So just kind of getting them to refocus and just either replacing that candy dish with something more nutritious, like a bowl of fruit, for instance, if they just want to have something sitting on their desk. Because just like with their prior drug of choice, if it's easily accessible, it's almost impossible to kick the habit. And if they can continue to eat it in moderation, they will remain addicted, and the dopamine response sugar craving will continue. And again, just like with any other addiction, they have to stop using sugar completely. Now, if they go cold turkey, then breaking a sugar addiction generally takes a few weeks. They should choose to slowly reduce their sugar intake rather than going cold turkey, because it may be a little easier for some people to just take a process, to do a process, rather than just say, okay, I'm taking sugar out altogether. And an example of reducing it slowly is to not eat dessert after dinner, or they can slowly reduce the sugar in their coffee or their cereal. And if they follow some sort of structured process, then over time, they will lose their need for that sugar taste, because our taste buds can be easily retrained. And many people find it surprising that if they have not had sugar in a long time and they try to eat a piece of cake again, for instance, then it's way too sweet. And I've actually experienced this myself. So literally, if a person goes, I would say, 2 weeks to a whole month without eating like candy, drinking soda, the really sugary things, your taste buds will actually change. And literally trying to reincorporate or reintroduce that after a long period of time, your body really won't even want it. You won't have that craving anymore. So now I just want to ask if there are any questions.
Yes, I do have a couple. Is the sugar addiction more prevalent across a particular gender?
Well, actually, I haven't come across any research regarding that, but I can look into that, and we can respond to that through email. But I can just say we as humans sort of operate the same way. So I really, that's something that I can look into to see if there is, an area, of people that kind of consume more than others.
Okay. And would you please repeat the daily amounts of sugar?
Yes, if it's okay, I can actually, it's between the men and the women. It was 6 teaspoons, no more than 6 for women, and no more than 9 for men.
Okay, that's it. Thank you very much. You can continue now.
Okay. Now, we were talking about, acquiring new habits, helping the clients just kind of refocus on doing other things to relieve their stress, to just learn, as I'm sure they're being taught in recovery, just relearning how to do something. So our whole focus is, as they're making that transition from substance abuse, we're trying to prevent this sugar addiction. So if you're thinking of clients now and they're already in that mode, or if sometimes we get to know our clients and patients, and we can kind of sense if someone is heading in that direction. So I came up with some first steps which can be incorporated and followed along with in their recovery process. And that is to ask for help from a partner, family, and friends. And again, taking step by step, taking little steps, small steps, not taking a big plunge and trying to go cold turkey. And that is to cut out 1 sweet food from their diet each week. This is an important one. Eat more fruits and vegetables. And here's like a little hint. Sometimes just heating up a piece of fruit can satisfy a craving because it makes the fruit sweeter. And for example, a person can cut up an apple, sprinkle it with cinnamon, and saute it in a tiny bit of butter, and it'll be a good substitute for apple pie. Now, they may not have the crust, so in place of the crust, they can sprinkle a little bit of like walnuts or pecans on it, just for a crunch, or just to take the place of a crust. And another thing they can do is buy foods without sugar and just add enough to satisfy their taste. For instance, if I don't know if anyone's familiar with, like, they have almond milk and they have coconut milk. Well, if you can teach the clients to buy unsweetened versions of those things, and plain yogurt, and add fruit to it, add granola to it, a healthier version of granola to it. Those are steps that a person can take. That way they're not consuming so much sugar. And again, yogurt, I threw yogurt out there because yogurt is another food that is very high in sugar, especially the ones that already have the fruit in it. So a good substitute is to teach the person, just buy plain and add flavors to it. That way you can control it from home, and you can kind of watch the level of sugar that you're adding. Okay. Now, we are wanting to move on. Okay. Okay. Now, another thing that I thought that was pretty important is what you can do to help. And what I meant was what a practitioner can do to help, what a counselor can do to help. And that is, again, we refer back to teaching the people to listen to their bodies. And they need to actually do this because they need to recognize their obsessive cravings. Serve healthier alternatives for snacks at a group meeting. So, for instance, if you conduct group meetings, instead of having, like a lot of people do, a buffet of sweets and pies and cookies, all healthier alternatives could be a vegetable tray. Instead of having soda, there. You can have water, coffee with a choice of honey or a healthier sweetener. Also, too, a cheese and cracker tray instead of cookies. So that, as you can see, that's examples of how a practitioner can help. And also another important one is to help people set goals during recovery, and that's to avoid the replacement highs that we talked about. Again, it's all focused on how we want the person to rethink things. That is very important. And listening to their bodies and starting to understand their body, what their bodies are telling them that they need, is also very important in prevention, or if a person's already addicted, that is something to teach them to do too. Are they feeling depressed? Do they need a pick-me-up? At the time that they're reaching for that sweet, they just teach them to take a step back and analyze to themselves what's really going on. Am I feeling lonely? Am I depressed right now? And also another thing that they can analyze is, do they need to cut down on carbs or caffeine? Because how is that, when they're eating that type of food, how is it making them feel? You know, are they feeling tired or anxious? So those are different ways to teach the person to pay attention to what their bodies are doing. And other ways to help is to educate them to become aware of the chance that they can go into eating sweets during recovery. You know, it's not putting it out there for them to be afraid of. It's just saying, hey, you're going to start to feel like, you know, you're feeling a void. You're used to turning to this substance to relieve, you know, the pain that you have. So there's a chance that you could possibly turn to eating sweets, because you'll start to feel better eating that when you first start out. So it's no harm in just kind of telling them, hey, this is something that could actually happen. And you can also help clients focus on their reasons for not wanting to get started. For example, do they want to continue to feel better while they're on the path of recovery? Do they want to lose weight? So these are different ways to just help clients create goals or create a why as to why they would not want to go into eating sugar, eating sweet foods. And this can be determined while they're recovering from a substance. This could be incorporated if you're maybe sensing that a person could go in this direction, or a person comes to you and they're saying, oh my gosh, I'm eating tons and tons of cake, for instance. So focusing on their why can really help them want to eat healthier, so that they can prevent another addiction or not start looking for a substitution while they're making that transition away from their prior addiction. They can be led to an outside resource to help them with prevention as well. And some of these outside resources are meal planning services, finding healthy recipes either for them or telling them that they can go to Google and just finding alternative ways to make what they're craving. Like, again, we'll use apple pie. They can find a healthier alternative for that. There are also health coaches like myself that can help coach them through just many different levels of what they're experiencing regarding their health. And, of course, nutritionists. They're out there to help someone get started and stay on track. And people feel overwhelmed with all the information out there. So the best thing to do is supply the clients with a few options to help them start somewhere. Let's see here. I guess I want to just also ask if there's any questions, again, at this point.
Yes. Is there evidence-based screening tools to identify sugar addiction?
Is there tools?
Right. And like Expert, we have the screens to ask people about their drug and alcohol intakes. Is there anything like that that people are asking patients, clients about their sugar intake? Is there any sort of a screening tool that is used?
You know what? The main thing, I can just say that, for instance, health coaches would use is a food diary. You know, I would say to start is if the person is just, even, I'm sure, like during their counseling sessions, for instance, it will kind of become revealed. You can ask them, just straight out ask them, hey, how have you been handling your stress? How have you been handling the problem in your marriage? You know, just starting off with questions. And it will be revealed at that point. Oh, you know, someone is having a problem, will say, you know, when I get upset, I just grab my Ben & Jerry's ice cream and I sit down and that just relieves me. That just totally relieves all my stress. But as far as actual tools, I would definitely say a food diary.
Okay. Is consuming Splenda or stevia a good alternative, or will these cause sugar cravings as well?
There are a list of quote-unquote better sugars. Stevia is a good sugar alternative, but you have to watch for, I would say, as often as you can with that type of thing to go organic. And honey, for instance, it's good to look for like raw honey, organic honey. Those are the better sugars. Again, when you're talking about someone who has an addiction, little to no sugar is their option until they can kind of get back on track. But stevia, you can find the better stevias in like a Whole Foods or a Trader Joe's.
Will insurances reimburse for health coaching?
As of now, it's no, and that's unfortunate. Just like health insurances, because I did inquire about that actually, especially when health insurance actually just took a big change, the Obamacare. And I did ask someone who was pretty active in the change, if in fact healthcare would cover alternative things like health coaching, and they said unfortunately no. So I'm hoping that's something that will change in the future.
And somebody just asked for you to explain a little more about the sugar substitutes.
Explain the sugar substitutes.
Well, how do they react, and what are some precautions to use?
Okay, sugar substitutes. When I was specifying sugar substitutes, I more so was focusing on like replacing the sugar with fruit, with you know, just things. When you're talking about a person that's craving sugar on a high level, they've eaten a lot of processed sugar, a lot of the white processed sugar, and that's, again, from the beginning when I explained, that's stripped from all the vitamins and all the minerals. And that affects our blood sugar levels, and it wreaks havoc. That's what I had found out. And when you're talking about a person that's in addiction, in the middle of it, it's best to just take them off by substituting with other things. And the best thing that I say is fruit, is sweet potatoes, for instance. You can take a sweet potato and actually cook it and put some cinnamon on it, and it will actually fulfill that craving. So carrots, making smoothies, those type of options will help a person cut down on that desire for that unprocessed sugar. So that's what I meant by substituting.
Okay. And is sugar addiction similar to alcohol addiction? If somebody tells us 2 candy bars, do we double it, or are most people truthful and not embarrassed?
Can you repeat that one?
Yeah. They're asking if it's similar to alcohol addiction. Like somebody will say that they have 2 candy bars a day. where in reality they probably have 6. Are they pretty truthful when talking to you, or do people get embarrassed and try to minimize their intake?
Well, I tell you what, if a person knows that they have a problem, but if I'm actually with them, then I personally can't say if a person has been fully addicted to a substance, would they do that. But 9 times out of 10, if a person is with a health coach or a nutritionist, they're realizing that there is a problem that they want to stop. So, usually they will tell the truth, and I'm thinking that if they're not really fully giving the a clear picture, most likely it's because they don't realize that they're eating that much. So that is, again, back to the food diary, keeping track, taking notice, paying attention to what they're doing and what they're eating and how they're feeling while eating it and before they eat it. So most likely they'll tell the truth, but a person that's recovering, that's used to hiding, they might have a tendency, but the symptoms and signs will be there that they're consuming too much. Okay?
Okay, thanks.
So
can we just ask, I was just going to ask Vicki, she had texted something in the chat, but Vicki, do you want to talk a little bit about the Yale? She might not be able to. Okay, Vicki was just saying that, Vicki?
And I actually have some useful resources up here too, if people want to take note of that. Now, do we have time to talk about sleep at all? How much time do we have? That way I can kind of...
Yeah, that'd be great. Well, let's see. Yes, you can go into that. Thank you.
Okay. So moving on, again, here's some useful resources for sugar addiction and a couple of websites that someone can take note of to just get some further research on it. So we're going to transition into sleep problems that can occur in users and as well as those in recovery. Now, normal sleep consists of 4 to 9 hours of a 24-hour day with 2 broad phases, and that's rapid eye movement, or REM, that we're all familiar with, and non-rapid eye movement. And the amount of sleep required varies from person to person, and it depends on many factors. But normal, healthy sleep patterns definitely include these phases. So it's important to know if a person is finishing these phases. A few types of sleep disorders are narcolepsy, circadian rhythm sleep disorders. These are disruptions in a person's circadian rhythm cycle, like when it's daylight, it's time to get up. When it's when it's dark, it's time to sleep. Breathing-related sleep disorders. An example of that is sleep apnea. Another thing back to sleep apnea really quick. This actually causes people to they can actually hallucinate as well if they are not getting enough sleep because they're not breathing so well. So that's another important thing for a person to get tested for if in fact they're having those problems. Okay. So just moving on. But the one that I'm going to briefly discuss is the substance-induced sleep disorder. And this type of sleep disorder includes the use of or exposure to medications, toxins, alcohol, or other drugs. And illegal drugs such as cocaine, amphetamines, and these are huge culprits that rob addicts of sleep. Now, alcohol, a lot of people use alcohol to induce sleep, but the quality of sleep is often lacking during the second half of the sleep period, and it prevents them from going into the deep sleep. And the sleep disruption resulting from alcohol may lead to extreme fatigue during the day. So again, with sleep apnea and a person using alcohol to go to sleep, excuse me, those are 2 major culprits that cause sleep problems in a person recovering. And so, as we know, alcohol is a depressant, and it robs people of their sleep quality, as I stated. But a finding is the elderly are more at risk for alcohol-related sleep disorders than younger adults. And that's because they achieve higher levels of alcohol in the blood and brain, even when a person from both categories consume an equivalent dose. Addiction, as well as non-addiction to prescription and non-prescription medicines, can cause sleep disruptions too. The severity of sleep problems caused by medicine will vary from person to person. And some types of drugs that cause sleep problems are medicines with caffeine, like our pain relievers, cough and cold medicines. Of course, the illegal drugs. Actually, let me go back because, yes, I'm sorry. Okay. And the high blood pressure medicines and diet pills. Now, moving on to the next slide. All right. Now, symptoms of sleep problems. If a person is awake or asleep during off or unusual hours, if they're staying up late a lot, oversleeping, or if a person stays up for lengthy amounts of times or days to maintain their high, that is definite symptoms that a person is having sleep problems. Now, how drugs affect sleep. Addiction can alter, like I said earlier, the circadian rhythm, which is our internal clock that tells us when to sleep and awake, of course. But by introducing stimulant drugs like cocaine, for instance, at times when the body would be normally sleeping, like at night, it creates a disruption in the brain, and it changes the chemicals in the brain, of course, as we know. And withdrawal from these drugs is often associated with sleep disorders as well. Insomnia and sleep disruption can last long after a patient has completed recovery. So that's something to kind of look out for or teach the patient or client to consider. According to Khurshid MD, he's an associate professor in the Department of Psychiatry, and that's at the University of Florida College of Medicine in Gainesville. And he says that many people use alcohol as a sleep aid, and sleep problems can be serious enough to reverse the success of drug or alcohol treatment, and it could cause a relapse. So if they're actually experiencing sleep problems while they're in recovery or after recovery, it could cause disruption and cause them to relapse. And again, that focus will be on, okay, well, I slept better when I drank alcohol. So he's saying that according to a person having sleep trouble, if it's not addressed, they may turn to use that alcohol again to go back to sleep, for instance, or in their version of a good sleep. And also another thing is, he says if they are prescribed a sleep aid, they should do it on a short-term basis, maybe just a few weeks, and that's so the patient doesn't become psychologically dependent on that sleep aid. So, alternative methods to use for sleep treatment, and these are non-drug techniques. And again, we're looking to work with a physician, but we're also teaching the person to incorporate other things alongside of a sleep aid, alongside of their counseling, and teaching them to use their bed only for falling asleep, not reading, not talking on the phone, utilizing the bed as their sanctuary to get relaxation, making the room completely dark, no television, no night lights, no computer lights, that type of thing. And also it's important for them not to worry about not sleeping while they're lying in the bed, because again, that causes anxiety. It keeps the brain awake. They're looking at the clock, paying attention. Avoid caffeine, nicotine, and exercising too close to bed, because those are all stimulants that wakes the brain up, and it just makes it more difficult for a person to relax and go to sleep. Now, when a client is diagnosed with a sleep disorder, various alternatives should be discussed with them and not decided for them. And I have some, additional holistic treatments that are a good idea for clients to use. And these are herbs, acupuncture, yoga, biofeedback, meditation, and cognitive therapy. And this is utilized because some people respond to this, and because it identifies the individual's beliefs that cause them anxiety about their sleep problems. And this therapy actually helps them to replace these beliefs with healthy thoughts and healthy sleep behaviors. And usually the most effective treatment are for those that incorporate a combination of these therapies along with the client's treatment, clinical treatment. And it's becoming more common for physicians and therapists to treat substance-induced sleep disorders from a holistic approach. They are focusing more on using relaxation and herbal therapies and less medication. And it's also helpful to teach clients to restructure their daily living habits in order to improve their sleep habits as well. And that could be going to bed and waking up at the same time every day, avoid eating heavy meals or sugary foods or drinks too late. So overall, treating sleep disorders in with those addictions can greatly improve their chances of recovery. So just to wrap things up, and in summary, as you can see, these are many important factors. There are many important factors to consider for a client in recovery, as well as those who have completed the recovery. So it's good to consider to look out for the possibility for them to turn to sugar or even food as a substitute. And it's vital to watch out for sleep problems occurring, which can then add to their anxiety and how it affects their treatment. And it will help to work with their doctors to make sure that any sleep aids that they prescribe to their clients are monitored and given on a short-term basis. Okay, so I just want to thank everyone for attending this webinar, and I hope that you definitely can learn to, or have learned, that this is an important factor to consider in the recovery and treatment of your clients. Thank you.
Yeah, thank you so much. That was really interesting. I'm going to take the screen back now, and I would like to give you all a brief overview of our National ATTC expert website. This has a lot of information on expert, and I will give you the links in the email that you'll get later this afternoon. But this is what our website looks like. We're the National Screening, Brief Intervention, and Referral to Treatment site. And if you're looking for a regional center, we're part of a whole network of ATTC locations, which is Addiction Technology Transfer Center. To find your regional ATTC, you would just go to this map and you can click on what part of the country you're in, and you will see that region's page, and you'll be able to contact them, check out their resources, and learn what they're doing. Again, we have them all over the country, and they all have their own. Here's another webinar series going on, and they have a lot of specialty projects that they're working on. Now, there's also some national focus ATTCs, of which we're one. One is located out west, and it's the National Frontier and Rural ATTC. And there's also one focusing on the issues of North American Indian and Alaskan Natives. And then there's another for the National Hispanic and Latino ATTC. So those are others where you can get specific information too. I'll take you back to ours right now. So you'll be able to look up products, contact us if you want to. We just added a new digital tool here. It's a brief 4 or 5 minute overview of rethinking drinking. And here's where you can actually download the publication too. And we have other information here on here's a new hospital expert, the reasons for using it as a downloadable product. So over here you can see what trainings and events we have. These are the ones we have listed right now, and there'll be more, of course, as we populate them. And you can click on those and register right through there. We also have products listed, and these are just some of them with links directly to our webinar listings, that research snapshot. This one will take you to a lot of different screens that you hear about, the audit and the DAST and other items that are great brochures for downloading. So we have those available. And then we have special topics here. One is the National Expert Trainers Registry. If you're interested in finding a trainer in your area and contracting with them to go to your local site, maybe, and be able to train on Expert, same thing, you would just click on the region of the country where you live. And we have the trainers listed here, and you would be able to just go in, get their contact information, and see their background. And again, these are for every one of the ATTC regions. So this is really handy. These people have been recommended by the ATTCs, and so we know that they have a good background. Now we're adding additional expert resources too. This is one, and I'll be building this up too as we get more listings. And here's where we have some of those short versions called digital tools. We just took one off the front page, and you can link to that. That goes over the Pacific Southwest Revised Expert Curriculum. This is now, we have one coming up in a few weeks talking about the alcohol screening and brief intervention, and we just did another one too. So this is constantly going to be updated as well. Now, we are very lucky to be working with NORC at the University of Chicago. They're a partner of ours, and they also have quite a few great webinars that you can go to. We do a lot of them together, so we'll advertise and market a lot of their webinars, and they also have some on their webinar libraries too, which are great. Distance learning, you can see where to go to for online courses in Expert. And we have e-news, which isn't looking really good right now, but I'll have that banner back up. I'll fix it. This is our Expert newsletter that comes out occasionally. It's approximately monthly, but it comes out whenever there's interesting information to get out to the people who want it. Now, this also talks about upcoming webinars and conferences and articles, and you can register for that right here when you open up that link. So we have information about what exactly Expert is, gives you a really brief overview, and our advisory board, and again, how to contact us. So this is a great resource for our Expert products, as well as on a national level. You can find a lot of information there, and it's a good idea to find out who your local ATTC is, let them know that you're interested in the addiction and behavioral health disorders, and they'll have a ton of information for you. So this is just a quick overview, and I hope you will visit this soon. Again, I'll have the links for you in the email that you'll be getting from me later on. So I think that takes care of the webinar today. Thank you again so much for joining us. And please go to our ireta.org/webinars site to look at all the other good webinars we have coming up. There's one on lessons in integrating Expert into family health care centers. That will be on May 7th, and that's based on a pilot program in Orange County, California. And then on May 16th, we have one, post-traumatic stress disorders, PTSD in the military, and that will be presented by somebody at the VA National Center for PTSD. And there's a lot of other webinars on different topics too, so we hope you will join us again. So I think that's it. At this time, I'm going to close the webinar off, and thank you all for attending. Goodbye.